My name is Aaron Meyer. That's Aaron, E-R-I-N, spelled like a girl, M-E-Y-E-R. I'm a fourth year at Case Western, and I've been asked to talk about and approach presentations. I think for the sake of kind of simplification and time, we're probably going to just focus on presenting a patient in the hospital setting. The first time you've seen the patient, and talking about kind of what information you need to collect, and then how you're going to format that. And I'll give you some practical tidbits about how your attendings want to hear you present and what they want to hear, and the traps and things not to do. And then we can talk a little bit about maybe the second presentation and how it's going to differ from your first presentation. I think I neglected to mention that I'm going into pediatrics. I'm preparing to apply here in a bit. Because I'm going into pediatrics, make-believe patient is going to be let's make it a 6-year-old boy with asthma. So asthma. And that's asthma is very common. If you work over at Rainbow, there's a team, the orange team, that kind of is dedicated to dealing with asthma patients, and you get probably 70% of the team's patient load will be asthma exacerbations. So we said he's 6. So let's just pretend you know absolutely nothing about this patient. You walk in, the kid is most likely going to be accompanied by a parent or grandparent. So already you have kind of more challenging than your typical adult patient. You kind of have to deal with too, but that's okay. The parent can give you a lot of information, and sometimes parents know more about their kids than adult patients know about themselves. First off, we have to collect our information. Okay, so you guys should all be pretty well versed in conducting an interview at this point, and the kind of at least the pieces of the information you need to collect. So, interviewing your patient, you're always going to start with case-to-case favorite open-ended question, and just ask something like, tell me what happened, how can we help you, what brought you to the hospital today, and then the parent of our child is going to start spilling a bunch of information, and you need to organize that somehow in your head and make sure you're getting all the important parts of an HPI. HPI is going to involve timing, so when did it start, timing, and then how did it change over time, location, radiation, exacerbating, relieving. Please, no comments about my handwriting. So that looks good. Get your full HPI. And then from there, you can dive into what I like to do my review systems at this point. So I do a focused review systems. In our kid, just to give you an idea, things that might be important. Did he have a fever recently? Is he coughing? There are a lot of other things, kind of any sign of blue discoloration. You might want to know if he vomited at any point or if he coughed up blood. These are kind of the big red flag symptoms in a patient that's presenting with what you think is an asthma exacerbation. At this point, you can go ahead and collect your medical history, which is a very important part for the asthmatics, family history, and social history. For past medical history, so for past medical history, remember to always ask about things like hospitalizations. I don't know why I said that first, but I guess for an asthmatic, you want to know if they've ever landed themselves in the ICU or the hospital before. You want to know things like when was it diagnosed, so age of diagnosis. And remember, this is all going to really depend on the reason your patient is hospitalized. I'm just giving you guys an idea of how to think about it. Medications that they're taking. Have they ever been intubated? But this is, again, something I wouldn't expect you to know right off the bat. But if you're dealing with a lot of asthmatics, you want to know that. Any other diseases. Other diseases. Family history, not that complicated. Really, you want to know, is there any family history of any atopic diseases? And so you can limit your family history to a history of things that are relevant to the complaint, but if you're not sure what's going on, then you need to do a broad family history. Social history, I'm not even going to dive into this. This is so specific to the patient, but you always need to remember things like exposures. So where do they live? Where are they spending their mornings, evenings, afternoons, etc.? What's their diet like? The older patients get, you guys know, to include any history of tobacco, alcohol, drug use, sexual history, and then occupational history as well. And now once you feel like you've asked all the questions you need to ask, transition to your physical exam. So, physical exam. So let's see, here is our kid, our 6-year-old boy. We'll give him blue hair. Since we think that this is a kid with asthma, we can really focus it to heart and lungs and then kind of do an extremities check. So make sure you do a good lung exam. See, those are the little lungs there. Good heart exam. Go ahead and check the extremities as well. Pulses, look for cyanosis, look for clubbing. And then always remember your vitals. Maybe the nurse is taking a temperature, so we'll give him a temperature of 38, respiratory rate of 35, and then the pulse is going to be 90. No signs of cyanosis. We don't really think he needs to be on any sort of oxat monitor, and you can see that he's basically just tachypnic. At this point, you talk to the mom, you've got all the information you need to know, and you've examined the patient. At some point, though, your mom is going to be like, okay, so how long am I going to be in the hospital? And mom's going to start asking you questions. And these are things you can answer if you feel confident, but you can always say something like, let me go talk with my team, and I'll be right back, and I can give you a little bit more information.